The Prime Minister has today ordered a review into 3 public health scandals that have made headlines in recent months. Theresa May announced the government will look into vaginal mesh implants, epilepsy drug sodium valproate and pregnancy test promoters. Thousands of furious victims have been affected by the controversial issues, which have left women on the brink of suicide and caused serious birth defects. Baroness Julia Cumberledge will lead the review, which was announced by Mrs. May during Prime Minister's questions this morning. Mrs. May told MPs that she wanted to see a faster, more understanding response to patients when they raise concerns. While Health and Social Care Secretary Jeremy Hunt has admitted the reaction to the scandals has not always been good enough. The review will delve into how the authorities responded to concerns raised by those affected and establish whether fears were raised upon. Public inquiries into each of the 3 issues, which Mail Online has repeatedly raised awareness of, could be undertaken if the government sees fit. Campaigners have announced their delight over the news, which has come after years of relentless fights for justice and often being dismissed as mad. Mrs. May was asked about promoters specifically by Tory former Minister Sir Mike Penning, who has campaigned on the issue. The Prime Minister replied, "I recognize that there are many individuals whose lives have been affected by this. There are very powerful stories of these individuals. I know this has been of concern across the whole of this House, and the concerns raised by campaign groups, not just about promoters, but some other issues like vaginal mesh and sodium valproate, I think have highlighted that there is an issue with our regulatory and healthcare system, and we are determined to address it." "I've been clear that we need to do better. I was very struck by the stories, the powerful stories I heard. We do need to see a faster, more understanding response to patients when they raise concerns." If Sir Mike can be a little patient, Health Secretary Jeremy Hunt will be making a statement this afternoon setting out his plans to the House for a review on these issues. Mr. Hunt said, "Over the years, there have been significant concerns raised by individuals and campaign groups about the potentially harmful effects of 3 products used by the NHS. The response they have received from those in positions of authority has not always been good enough. From promoters to mesh and sodium valproate, patients and their families have had to spend too much time and energy campaigning for answers in a way that has added insult to injury for many. I want to see if we can establish a fairer and quicker way of resolving these concerns both now and in the future." Mr. Hunt also announced plans to invest £1.1 million to develop a database for vaginal mesh which could help identify safety issues. Baroness Cumberledge said, I look forward to undertaking this tremendously important review, and in particular to working with patients to ensure that our health system learns from those it may have failed. It's essential that voices aren't just listened to, but properly heard, and that whenever appropriate, the system promptly learns lessons and makes changes. Commenting on the news, chair of the All-Party Parliamentary Group on Surgical Mesh Implants, MP Owen Smith said he was delighted. Lessons must be learned from the awful complications many women have experienced since undergoing mesh surgery, and proper processes must be put in place to stop this happening in the future. The mesh scandal shows what can go wrong when devices are aggressively marketed to doctors and then used in patients for whom they were unsuited or unnecessary. Mesh devices should be seen against that history of medicalization and mis-selling, and should be subject to the most stringent clinical trials before being deployed in surgery. Kath Sansom, founder of Sling the Mesh, a campaign group calling for a ban on mesh, said, "We are delighted that at last a review is to be carried out, but also deeply saddened that so many women's and families' lives have been shattered by medical devices and drugs that were never tested on humans before being released en masse to women globally." We were the human guinea pigs. These are three huge women's health disasters. The people who benefited most were the shareholders and big CEOs. It is wrong that women have had to fight for years to get their voices heard, often being dismissed as mad, hysterical, or a minority suffering. Had man been hurt by drugs or implants on this scale, there would be an outcry. Instead, we have been left to suffer in silence. Every woman affected by Primodos, Valproate, or mesh implants have suffered personal tragedies that can never be compensated for. But Marie Lyon, chairwoman of the Association for Children Damaged by Hormone Pregnancy Tests, said, "We are disappointed that the three campaigns are being reviewed together. We are not prepared to support this proposal without consultation and agreed terms of reference."